Good morning, student. Here we discuss about airborne disease, which are the part of your chapter. Why do we fall ill? Okay. So, beta, airborne disease. If you define airborne disease or understand airborne disease, so these diseases are passed from one person to another when microorganisms such as bacteria, fungi, or viruses travel through the air in aerosolized particles like chickenpox, the common cold, and COVID-19 can also be transmitted in this way. So, airborne disease can transmit through cough or sneezes, spraying liquid or dust. The microorganism may come from a person or animal who has a disease or from soil, garbage, or other sources. So, there are many types of airborne disease, and the symptoms, treatment, and outlook will vary according to that disease. So, and a way of preventing transmission include the use of personal protective equipment and effective ventilation system. It depends on the diseases. An individual can help prevent transmission by avoiding close contact with other or wearing a face covering mask. Okay, so here we discuss some important diseases which are spread by air and that are called airborne diseases. Okay, even according to Center of Disease Control and Prevention, airborne disease can spread through a direct and indirect form of transmission depending on germ involved. So the pathogen may enter the air in wet droplets, for example, when someone breathes or sneezing. They will be suspended in the air and then some droplets dry out, leaving microscopic particles while suspended in the air. And these particles can attach to or enter the body system of people nearby. So, for this purpose, we have to be define here first airborne disease. That one is common cold. As you seen your screen, this is a picture of common cold. So here we first discuss causes of common cold. So causes of common cold, that both the flu and common cold are contracted by coming into contact with an infected person. Mean being in the vicinity of an infected person when you means he or she coughs or sneeze ejected disease causing virus into the atmosphere, and also by coming into contact with the contaminated item like tissue used by an infected person. Mostly you uses door handles. Okay, hand raises and the telephones, and then touching your nose or eyes that give the virus. So these are the causes which are the responsible for common cold. Symptoms of common cold, that we know that the both flu and common cold may seem like the same thing, means both are viral disease, not bacterial, as such cannot be treated with antibiotic. We also elaborate it in our earlier lecture. Okay, and also common cold does not lead to life threatening complication which flu often result in. And common cold is a viral infection affecting the upper respiratory system, commonly caused by the rhinoviruses. It is very important, beta, please remember it. Okay, so respiratory virus, it's a parainfluenza and a coronavirus are the same. Okay, so common cold can be diagnosed if the patient exhibit the following symptoms like running nose, sore throat, coughing, sneezing, and all. Okay, the second one, airborne disease is flu. Okay, so flu virus are of the three kind of most cases in human flu can be attributed to like type A virus, which also induce some disease in animals. Type B, it is not as common and it is responsible for causing illness and that are not too severe. But type C viruses usually mild flu and rare, and the symptom of these flu are like sudden fever, dry cough, headache, sore throat. All these are the symptoms of flu, which are also the same as the symptoms of common cold. Now prevention of flu, if we want to prevent ourselves from flu, so always cover our mouth with the tissue or our hands with coughing or sneezing. So when we cough or we are sneezing, we have to be do it. Second one, if you don't have access to soap and water, use Dettol wipes. Okay. Third one is regular clean and disinfect surfaces that come into a lot of human contact, especially door handles and taps. Okay, because taps are usually used in all areas. Okay, and fourth one is avoid contact with people that have contracted a cold or flu, and avoid means touching or using things they have come into contact with them. So these are all the symptoms disease of common cold and flu. They both are the disease of airborne disease. Third one disease also a airborne disease. We call it influenza. Of course, it caused by virus that lead to respiratory illness. Means it is highly contagious and spread especially through cough and sneeze of an infected person. Uh, if you remember, if you just get idea that all symptoms of airborne disease are mostly are same. Okay, like if you talk about influenza, the symptom like headache, aching limbs, aching in limbs, high temperature, uh, okay, and cold, sweat, all. In maximum cases, influenza is not serious. It is just uneasy. Okay, however, in some unfortunate condition cases, the flu can lead to severe complication and the risk of going through severe influenza, like people above the age of 65, young children and babies, people with cardiovascular heart disease. These all those people which have this type of conditions, that they get influenza in very hard condition. Okay, so now we talk about the treatment of influenza. So antibiotics are useless unless the flu has progressed to other illness caused by the bacteria. Okay, like stay put at home, avoid contact with other, keep your hand protected from germs, consume plenty of water liquid, stop smoking. Okay, even if we talk about the prevention, that getting vaccinated is better. Okay, so this is all about influenza, which is also a viral disease. Now here we go with our fourth disease. This one is measles. Okay, uh, measles a viral infection that's serious for small children but is easily preventable by a vaccine. It is also done in Anganwadis. Okay, so the disease spread through the air by respiratory droplets produced from coughing or sneezing. And if you talk symptoms of measles, that measles symptoms don't appear until to 10 to 14 days after exposure. They include cough, runny nose, sore throat, and fever. And if you talk diagnose, then doctor can confirm measles by examining your skin rashes and checking for symptoms that are characteristic of the disease, such as white spot in mouth and fever, cough. Okay, so these are the symptoms for measles. If we talk about the treatment, so no specific treatment is there. A measles vaccine given within 72 hours of exposure. Doctor advise acetaminophen or ibuprofen for this. Plenty of fluids. Okay, and as we said that measles are mostly in babies. So if we just talk about measles in babies, then the measles vaccine isn't given to children until they are at least 12 months old. So baby also receive baby also receive passive immunity, which is provided from mother to child through the placenta during their breastfeeding. Okay, there is also antibodies, IA protein antibodies are made in small children, which prevent them from measles. Like rubella, I know you heard about rubella. Rubella is German disease. Okay, so this is all about measles. Now here we go with our last airborne disease, but tuberculosis and many time I already said that tuberculosis is more dangerous than coronavirus which is present in this time. Okay, because it quickly suddenly get contaminated another person, just infected other person by talking, by sharing something or etc. So tuberculosis, it is a contagious infection that usually attack your lungs. It can also spread to other parts of your body like your brain and your spinal cord. Okay. So there is always one question that can tuberculosis be cured? But yeah, in the 20th century, TB was a leading cause of death in the United States, and you have to take medicines for at least 6 to 9 months. Okay, so now yeah, tuberculosis is cured today, but their process is of 6 months. If you not take 6 months properly, this virus, this bacteria again attack yourself. Okay, now sign and symptoms of tuberculosis: that a cough that lasts more than 3 weeks, chest pain, night sweats, chills, fever, loss of appetite. Okay, these all are the sign of symptoms of tuberculosis. And you could be more likely to get TB, one F frict or a co means means you could easily get this TB virus by a friend, your co-worker or family member that has active TB. Okay, so these are very important to know about, to aware about the tuberculosis prevention. That if you have an infection, take all of your medicine so it doesn't become active. Limit your contact and wear mask always if you have tuberculosis or active tuberculosis. Okay, so beta, here today this is lecture about only the airborne disease. I hope you understand this. But even in all of that, if you have any query, please contact me. Please join your Google Meet class where we discuss your problems. Okay, thank you.